And joining us now, Dr. Richard Besser, former acting director of the CDC and now president and CEO of the Robert Wood Johnson Foundation. Dr. Besser, good morning. So we see that the Biden administration has ordered more doses. We have a supply problem. We have a distribution problem. What do you feel needs to be done, and is it happening?
Well, I think, Savannah, a couple things need to happen. One is we have to up the conversation around what is going to turn the tide on this pandemic this winter, and it's not vaccine. Vaccine is the long game, but if we don't get people to double down on wearing masks and keeping apart and washing their hands and waiting their turn for when they should be getting vaccinated, we're going to be at real risk, especially as this UK variant starts to spread more around the country. Any lapses in those public health recommendations, in our following of those, is going to cost us in a really big way.
Let's talk about those variants, because it's said that they're more contagious, potentially with the UK variant, potentially more deadly as well. I mean, it's a practical matter. If those strains become dominant and they're more contagious, does that mean it takes less time to get infected? Less time with an infected person will result in an infection for yourself?
Well, I haven't seen data on time, but what it does say is that if we're sloppy, if we're not doing those things that we need to do, it will spread easier. And as Dr. Fauci was saying, these are likely not the only variants or mutants that we're going to see. So upping the ability of the CDC and local public health to track strains, to look for new mutants, to look for any signs that vaccines are not as effective, any signs that medications aren't working. That's part of the ongoing battle with the virus that we have to do.
Are you in the double masking camp? Do you think you should wear a double mask or try to get one of those N95s if you can?
I'm not a double masker. I am a big pusher for everyone to wear one mask and to please not wear it down on your chin. If it doesn't cover your nose and your mouth, it's not going to be effective. I'm looking forward soon to the CDC issuing guidance around the masks that we purchase, rating them in the way that they do for masks among healthcare workers, because that'll give us a better sense as to which masks are the right way to go.
Well, you mentioned the CDC, and it seemed somewhat sudden, coming out yesterday and saying schools should reopen, that the research suggests that schools are not a primary source of community transmission. What is behind the recommendation there, and what do you make of it?
Yeah, I mean, I wrote an op-ed on that back in December. It's been clear that schools that have been given the resources have been able to ensure that they can screen staff and children, that they can do social distancing, that they're ensuring people are wearing masks, that it's a safe place. And for many children, it's a much safer place than being out about in the community. And I know as a pediatrician and as a parent, children need to be in school learning. So if we can make it safe for children, make it safe for staff and for teachers, we really need to do everything we can, like so many other countries have done, to get children in school learning. And it points to the real importance of not just counting how many people are getting vaccinated, but are the right people being vaccinated, frontline essential workers, including teachers, so that we can get our society up and running in as safe a way as possible, especially for those people who have to go to work every day and can't work remotely like I can.
Yeah. All right, Dr. Besser, thank you as always.
Hey, thanks for watching our YouTube channel. Find your favorite recipes, celebrity interviews, uplifting stories, shop our favorite deals, and so much more with the Today app. Download it now.